Lesson number 6, lifting and moving patients. At some point in many emergency situations, you will need to lift and move a patient. Sometimes this will be to provide easier access to administer first aid. At other times, you will need to move the patient to a safer location. You may also need to move a patient to transport them to the hospital. This chapter will teach you how to quickly and safely lift and move patients. This is a scenario that we will discuss in person. Your fire rescue unit is summoned to a recently remodeled building in response to a 911 call for a reported fire. You arrive to find smoke filling the area. 2 people carry a man through a doorway. 3 others stagger through and collapse to the ground. Smoke is blowing over them. Flames flicker inside the structure. You quickly size up the scene and determine that the structure should be secure for the next few minutes. There is a large grassy area that extends at least 200 feet in front of the building. So just think about this scenario and how you would address this issue and all the different issues surrounding the issue. We have smoke, we have flames, different issues. So this is something we will discuss in person. Factors that affect moving a patient. Before you act, always size up the scene and consider the factors affecting the situation. Any dangerous conditions at the scene, the distance a patient must be moved, the size of the patient, your physical ability, whether others can help you, the mechanism of injury and the patient's possible condition, any aids or equipment to facilitate patient transport at the scene. Failing to consider these factors could cause injury. If you were to become injured, you might be unable to move the patient and could risk complicating the situation and making things worse. Principles of body mechanics. Body mechanics refers to the field of psychology that studies muscular actions and the function of the muscles in maintaining the posture of the body. In other words, it is the study of using your body in the safest and most efficient way to achieve a desired outcome. Make sure to employ the following principles of body mechanics when lifting and moving a patient. Keep your back straight. Lift with legs, not the back. Use the muscles in the legs, hips, and buttocks, and contract the muscles of your abdomen. Maintain a firm grip on the stretcher or the patient, as well as any other pieces of equipment being used to move the patient. Being sure to never let go. Keep the patient's weight as close to your body as possible and maintain a low center of gravity. Follow the manufacturer's operating instructions for the stretcher and equipment you are using. Avoid twisting your body as you lift. Maintain a firm footing and walk in small measured steps. When possible, move forward rather than backward. Use good posture. Poor posture can fatigue your back and abdominal muscles, making you more prone to injuries when standing. Your ears, shoulders, and hips should be aligned vertically. Your knees should be bent slightly and your pelvis tucked slightly forward. When sitting, your weight should be distributed evenly and your ears, shoulders, and hips should be aligned. Techniques for safely moving patients. Always begin your lift facing the patient or object and with your back in a locked-in position. Keep your legs shoulder width apart, head up, back straight, and shoulders square. Keep the weight of the patient or object as close to your body as possible. Tighten the muscles in your back and abdomen and keep your back straight while you lift. Keep your arms locked and avoid twisting while carrying. The power grip. The power grip allows for maximum stability and strength from your hands. To perform the power grip, grab the object so that both palms and fingers come in complete contact with the object. All of your fingers should be bent at the same angle. The power lift. The power lift technique provides a stable move for the patients while protecting you from serious injury. To perform the power lifts correctly, remember to keep your back locked and avoid bending at the waist. Position your feet, making sure they are on a flat surface and are a comfortable distance apart, usually shoulder width, and turn slightly onward to provide maximum comfort and stability. Bend your knees. You should not feel like you are falling forward. Tighten your back and abdominal muscles. Keep your back as straight as possible and do not twist or turn. Make sure your feet are flat and your weight is evenly distributed. Position your hands. Use the power grip once your hands are in position. Grip the object in the way that is most comfortable and stable. For most people, that is approximately 10 inches apart. Lift, keeping your back locked, and make sure your upper body lifts before your hips do. Reverse the process to lower. Now we're going to discuss the squat lift. The squat lift is an alternative to the power lift and is useful if one of your legs or ankles is weaker than the other. Remember to avoid bending at the waist when performing this lift. Stand with your weaker leg slightly forward. The foot on the weaker side should remain flat on the ground throughout the lift sequence. Squat down until you can grasp the object. Use the power grip. Push yourself up with your stronger leg. Keep your back locked and lead with your head, lifting your upper body before your hips. Reverse the procedure to lower. Reaching. Emergency medical responders will often have to reach for equipment or patients. To minimize the risk of injury, try to reposition the object to avoid reaching and lifting. If that is not possible, reach no more than 20 inches in front of your body. When reaching, keep your back in the locked position and do not twist. Support your upper body with your free arm. When reaching overhead, do not lean back from the waist, hyperextending. Correct reaching for log rolling. The log roll is usually performed when a patient is suspected of having a spinal injury. Ideally, 4 people working in tandem perform it. One responder is located at the patient's head, while 2 or 3 others perform the actual move. The patient's arms should be at their side with their legs straight and together. The responder at the patient's head directs the movement and maintains spinal motion. Push rather than pull whenever possible. Pushing and pulling. There may be instances when you will need to push or pull an object. Push rather than pull whenever possible. If pulling an object is necessary, keep your back locked and bend your knees slightly. Keep the lobe between your shoulders and hips and close to your body. This will keep the pull line centered with your body. If you need to push an object, try to push from the area between your waist and shoulders whenever possible. If the weight is below the waist level, push from a kneeling position, keeping your elbows bent and your arms close to your body. This will increase the force you can apply. Avoid pushing or pulling objects overhead, as there is an inherent risk and likelihood of injury. Carrying. When carrying, keep weight close to the body with the back in a locked-in position. To minimize injury, both to yourself and the patient, follow these guidelines when carrying the patient. Before lifting or carrying, estimate the total weight to be lifted or carried. Do not forget to include the weight of any equipment used in addition to the weight of the patient. Know your own physical abilities and limitations. Do not overestimate your abilities or those of your team members. Call for additional assistance if required. Do not proceed with a patient move until you can do so safely, regardless of your first instinct. Communicate clearly and frequently with your partner and patient and other EMRs. When you carry, keep the weight as close to your body as possible with your back in a locked-in position. Bend and flex at your hips and knees rather than at your waist. Indications for emergency moves. In any emergency move, take care to protect the head, neck, and spine. If you suspect the patient of having a head, neck, or spinal injury, only the clothes drag or blanket drag are safe ways to move the patient. Avoiding immediate danger. Danger to you or the patient from fire, close proximity of explosives, or other imminent hazards, lack of oxygen, risk of drowning, possible explosion, collapsing, structure, or other reasons such as uncontrolled traffic hazards, civil unrest, or extreme weather conditions. The need to access other patients. Gaining access to other patients, a person with minor injuries may need to be moved quickly to allow you to reach other patients who may have life-threatening conditions. Provision of proper care. Providing proper care. A patient with a medical emergency, such as a cardiac arrest or heat stroke, may need to be moved to provide proper care. For example, someone in cardiac arrest needs CPR, which should be performed on a firm, flat surface with the patient positioned on the back. If the person collapses on a bed or in a small bathroom, the surface or space may not be adequate to provide appropriate care. These are some emergency moves here. One is the clothes drag. The clothes drag is an appropriate emergency move for a person suspected of having a head, neck, or spinal injury. This move helps keep the head and neck stabilized. To carry out a close drag, gather the patient's clothing behind the neck, using the clothing to pull the patient to safety. During the move, cradle the patient's head by both the clothing and your hands. Move carefully since you will be moving backward. Keep your back as straight as possible and bend your legs. This type of emergency move is exhausted and may result in back strain for the responder, even when done properly. The blanket drag. The blanket drag is a good way to move a patient in an emergency situation when stabilization equipment is unavailable or the situation dictates that there is not enough time or space to use stabilization equipment. The blanket drag is appropriate for a patient suspected of having a head, neck, or spinal injury. Position a blanket or tarp drape, bedspread, or sheet next to the patient. Keep the patient between you and the blanket. Gather half the blanket and place it against the patient's side. Being careful to keep about 2 feet of blanket above the patient's head, roll the patient towards your knees, reach across and position the blanket directly next to the patient. Gently roll the patient as a unit onto the blanket. Being careful to not twist the patient's spinal column. After smoothing out the blanket, wrap it around the patient. Gather up the excess at the patient's head and drag, being sure to keep the patient's head as low as possible. Move carefully because you are moving backward, and keep your back as straight as possible. Next, we have the shoulder drag. The shoulder drag is a variation of the closed drag in which you reach under the patient's armpits from the back, grab the patient's forearms, and drag the patient. Keep your back as straight as possible and do not twist. This move is exhausting and should be done carefully. Since you are moving backward, the move may result in back strain. This move is not safe for a patient suspected of having a head, neck, or spinal injury. Next, we're going to discuss the ankle drag. For the ankle drag, also known as the foot drag, firmly grasp the patient's ankles and move backwards. Pull on the long axis of the body and not bump the patient's head. Keep your back as straight as possible and do not twist. Move carefully because you are moving backward, which may result in back strain. This move is not safe for a patient suspecting of having a head, neck, or spinal injury. Next, we have the firefighter's drag. For the firefighter's drag, position the patient on the back. Bind the patient's hands together gently at the wrist. Alternatively, you can strap a belt or other device behind the patient's scapula. Loop it around the straps on your air pack and fasten. Straddle the patient on your hands and knees and slip your head through the patient's arms. Place the patient's bound wrist behind your head. Keep your back as straight as possible and keep the patient centered under you. Slowly crawl forward, carrying the patient with you. Be careful not to bump the patient's head. This move is not safe for a patient suspected of having a head, neck, or spinal injury. Next, we have the firefighter's carry. This is not appropriate for patients with head, neck, or spinal or abdominal injuries. Since the patient's body is twisted, the head is not supported, and the patient's abdomen bears the weight during the movement. To perform the carry for a patient who is lying face up, grasp the patient's wrist. While standing on the patient's toes, pull the patient over a shoulder. Finally, pass an arm between the legs and grasp the arm nearest you. Alternatively, you can kneel in front of a seated patient, place one shoulder against the patient's abdomen, and hoist the patient across your shoulders. Pull the patient over a shoulder. The patient's feet should be on one side and the head on the other. Pass your arm between the patient's legs and grasp the patient's arm that is closest to you. Keep your back as straight as possible. Lift with your legs and stand up. Next, we have the pack strap carry. The pack strap carry can be used on both conscious and unconscious patients. Using it on an unconscious patient requires a second responder to help position the patient on your back. To perform the pack strap carry, have the patient stand or have a second responder support the patient. Position yourself with your back to the patient. Back straight and knees bent so that your shoulders fit into the patient's armpits. Cross the patient's arms in front of you and grasp the patient's wrists. Lean forward slightly and pull the patient up onto your back. Stand and walk to safety. Depending on the size of the patient, you may be able to hold both the patient's wrists with one hand. This leaves your other hand free to help maintain balance, open doors, and removes obstructions. This move is not safe for a patient suspected of having a head, neck, or spinal injury. Non-emergency moves. A non-emergency move requires no special equipment and is generally performed with other responders. Do not use non-emergency moves if there is a possibility of a spinal injury. A non-emergency move is used to move a patient from one location to another, such as from the incident scene to an ambulance or other transport vehicle or to a stretcher, from a bed or to a stretcher, or from the floor to a chair. It may also be used to move a patient to a different position as part of the medical treatment. The best way to move a patient in a non-emergency situation is the easiest way that will not cause injury or pain. We're going to discuss the walking assist. The most basic move is the walking assist. It is frequently used to help patients who simply need assistance to walk to safety. Either one or two responders can use this method with a conscious patient. To carry out a walking assist, place the patient's arm across your shoulders and hold it in place with one hand. Support the patient with your other hand around the patient's waist. In this way, your body acts as a crutch, supporting the patient's weight while you both walk. A second responder, if present, can support the patient in the same way from the other side. Two-person seat carry. The two-person seat carry is a method of moving a patient that requires a second responder. To perform the two-person seat carry, put one arm under the patient's thighs and the other across the patient's back. Interlock your arms with those of a second responder, under the patient's legs and across the patient's back. The patient places their arms over the responder's shoulders. The patient is then lifted and the seat formed by the responder's arm. Keep your back straight and lift with your legs. Do not use this move for a patient suspecting of having a head, neck, or spinal injury. Okay, more non-emergency moves continued. We're going to discuss the direct ground lift. The direct ground lift requires at least 3 responders. The 3 responders line up on the side of the patient and kneel close to the patient. The patient should cross arms over the chest. The responder kneeling at the patient's head places one arm under the patient's shoulders, cradling the head, and places the other arm under the patient's upper back. The next responder places one arm under the patient's waist and the other under the buttocks. The third responder cradles the patient's hips and legs. On a signal from the responder at the patient's head, all 3 responders lift the patient to their knees and support the patient by rolling the patient against their chest. On the next signal, all will rise to their feet and move the patient to the stretcher. Reverse the steps to lower the patient. Responders should keep their back straight and lift with their legs. Next is the extremity lift. In the extremity lift, one responder kneels behind the patient, keeping the back straight, reaches under the patient's arm and grabs the patient's opposite wrist. The second responder kneels between the patient's legs and firmly grasps around the patient's knees and thighs. On a signal from the responder at the patient's head, both responders move from a crouching position to a standing position. The responders then move the patient to a stretcher. Equipment. Stretcher. There are several types of stretchers designed to deal with patient transport. Wheeled stretchers are the most commonly used when moving patients from a situation in which transport by ambulance for more advanced medical care is required. They are equipped with a collapsible undercarriage for ease of loading. Some models are pneumatic or electronic and help reduce the amount of manual lifting involved in patient transport. They use a hydraulic lift system to raise and lower the frame. Portable stretchers are lightweight and often are used as auxiliary stretchers in ambulances. Next, we're going to discuss the stair chair. The stair chair is used when a wheeled stretcher is deemed too long for the rescue or extrication. It is especially useful when there is a smaller elevator or staircase in which a long stretcher will not fit. It is recommended that 3 responders be present when using the stair chair to ensure patient safety. 2 to act as carriers, and 1 to serve as a spotter to watch for potential difficulties. Now to the right here, you see a backboard. Backboards are used to move a patient from the scene of the incident to a stretcher or another transport device. Backboards can also be used to provide spinal motion restriction of a patient's head, neck, and spine, and are considered a standard piece of EMS equipment. Positioning. Make patients as comfortable as possible while awaiting transport. Unless a life-threatening emergency dictates the necessity. Do not move an injured patient. A patient is usually moved by EMRs once the patient has been examined, evaluated, and stabilized. There are times when a patient's condition will dictate the position you place the patient in. Position of comfort. Patients with various injuries or illnesses may be placed in a position of comfort, which is the position that is most comfortable, unless the injury or illness prevents it. This might include a patient who is in pain, is experiencing breathing problems, is nauseated, or is vomiting. Recovery position. While recovery positions are not as used in an EMS or healthcare setting, it is important to understand how and when to use them. For patients who are unresponsive but breathing, normally with no suspected head, neck, spinal, hip, or pelvic injury, move the patient into a side-lying recovery position after completing your assessment and gathering a patient history based on local protocols. Patients with a suspected head, neck, spinal, hip, or pelvic injury should not be placed in a recovery position unless you are unable to manage the airway effectively or you are alone and need to leave the patient to call for additional resources. Supine position. In a supine position, the patient is lying face up. The supine position should be used when assessing an unconscious patient, when a patient needs CPR or assisted ventilation, or when a patient has suspected head, neck, or spinal injuries. In order to perform CPR effectively, for example, a patient must be lying in a supine position. Transport a patient in shock in a supine position. Restraints. Use only if the patient is in danger to themselves or to others and is in need of emergency care. Have police authorization, if required by law, before using restraints. Apply restraints using reasonable force. If restraints must be used, be sure that you have adequate assistance. You will need at least 4 responders trained in the use of restraints, plus an additional EMR who can advise the patient what is taking place. Plan out your actions before you take them. You must know ahead of time what each responder will be doing so you can act quickly and safely. Remember that both medical and law enforcement personnel need to be consulted prior to use of restraints. Always follow local protocols. All right, on the next slide here, this is a scenario that we will discuss in person. You are the emergency medical responder. You and 2 other firefighters get to the collapsed people. 2 of them are unconscious. One man indicates his lower left leg may have been fractured. You recognize the immediate danger to the 2 unconscious patients and to the others who have escaped from the building. Time is critical. You need to get everyone to a safer place. Additional fire rescue units and EMS personnel have been called out but have not arrived yet, and the fire continues to build. So think about what you would do in this situation. You have a lot of different circumstances involved in this situation, and we will discuss this in person.